Hi, my name is Kingsley Adodan. I'm a student of Transitional Career Institute of Nursing. Today, I'll be demonstrating how to perform a tracheostomy care. Before I get started, I have already assessed my patient, check on the physician's orders, explain the procedure that I'm about to carry on with my patient, and wash my hands. So I would like to introduce the items that we'll be using for this care. A tracheostomy kit, a sterile saline water, and hydrogen peroxide. So I'll go ahead and open the tap of the sterile saline and the hydrogen peroxide. Loosen it up. Then I will open the tracheostomy key to be able to set up the sterile fill for this procedure. I've already wash my hands again. Then I'll make sure when I'm opening the kit, I'm opening away from me. Then I'm going to grab the sterile gloves. So first of all, I'm going to use my dominant aim. So to be able to set up my sterile feed, I'm going to open this. And make sure the shiny part is facing downward. And I'm going to pick up, set up the sterile fill. This is the inner cannula brush to wash the brush. This is the fenestrated dressing, the pipe cleaners, and we have the Q-tips to clean around the Q-tips to clean around the stomers and the tracheostomy face plate. Then we have the strip to hold the face plate in place. Now we have three compartments. We have three compartments that we will be filling up with hydrogen peroxide and sterile water. So what I'm gonna do, I'm gonna walk around the table because I can stretch my hands across my sterile feed. If I stretch my hands across the sterile feed, that means the sterile feed is terminated. So to be able to get those hydrogen peroxide and the saline water, I have to walk across the stereo-feed. Then I'm gonna grab it with my North dominant hand. Then I'm gonna put hydrogen peroxide on the larger compartment. Now I can pull this aside. Then I'm gonna move over again and grab my stereo water. Okay, now I can pull this aside. The next thing that I'm about to do, I'm gonna put on the other part of my stereo gloves. I'll grab it at the cuff and I'm gonna apply it. Good. So now I have put on my stereo gloves and I can go straight to my patient and take off the inner cannula. Now I've taken off the inner cannula. The next thing I'm gonna do, I'm gonna mix the inner cannula and the hydrogen peroxide and leave it. I will grab my brush and I'm going to wash inside of the inner cannula. Wash the outside of it. You want to scrub. You want to make sure you clean it. If there's any crust in it, you clean it properly. Then you're going to put it in the stereo-sealing water. And you put this aside. You want to rest. You want to rest it. You want to rest it. Now, what we're going to do, we're going to use our pipe cleaners and clean it.
They'll probably do, you know, like
Clean inside. Past it. Clean it. You want to make sure when you're cleaning it, you clean it in the stereo. You clean it in the stereo feed so that in case it falls within the stereo feed.
yeah, the union's got.
Then you can pull this aside. Now we're gonna look around the inner cannula and see if there's any length in it, or if it's intact, if there's any crack, if there's anything. Now we'll look at it. There is no crack. Everything is in